So we're going to start with the components of a psychologically healthy workplace. So the American Psychological Association, or APA, has defined these different components of a psychologically healthy workplace, which include, if starting on the left here, we have employee involvement, which is really focused on providing employees with autonomy within their work and more opportunities, options to be involved in that larger level organizational decision making. And then they also refer what they call, instead of work-life balance, we've moved away from that terminology to work-life integration. So how this focuses on how we can provide employees with flexibility, possibly in things like when, where, or how often they work, as well as thinking about benefits to assist them in managing non-work demands. So for example, that might include some flexible leave options. This could be flexible work hour arrangements, with COVID-19 as well. And past that, we've seen flexibility in kind of workspaces too. But this could also include resources like life management resources, employee assistance programs for any type of home, or family life incident that they might be going through that could impact their work, and the possibility of compressed work weeks too. So kind of changing a traditional approach to the office 9 to 5. And then we also think about this aspect. So psychological safety also includes health and safety. So a focus on prevention, assessment, and treatment of different health risks, and also thinking about how we can encourage and support healthy lifestyles and behavior choices too. Then it continues into talking about employee growth and development, which focuses on issues that are related to improving employee competencies, or think about employee self-efficacy, career development. So this could be things I'm sure a lot of you might already be doing too, such as providing continuing education units for folks to maintain their licensure if you are in a licensed profession, additional therapeutic techniques or health approaches, right, to help your employees continue building and engaging in professional development. This could also be one-on-one kind of mentoring as well, maybe into leadership roles within your organizations. So that's just a few examples of what that might look like. So these components all together can result in improvements for employee well-being, which we know, right, based on the past couple trainings and then research in this area too, that employee well-being is really essential to your organizational functioning, right? And the success, efficacy, rate, efficiency of your larger organization or agency is dependent upon your employees. But at the same time, right, there's no one size fits all method to how to do this, right? To how to build a psychologically safe workplace, how to increase that employee well-being, and then in turn, right, increase that organizational functioning too, and support the clients and patients that you all serve in our communities. So we have to communicate alongside our employees, right, to start understanding what they need. And then as an organization, we can make changes in different components, right, where possible for these things. So with that, I want to open up. We've talked about psychological safety and health in the workplace, what those components look like, talking about how this is an important part of wellness in your workplace too. What are you as a leader and or kind of your organization or agency currently doing to create a psychologically healthy workplace? So I'm going to stop talking and let's hear from folks around what they're doing in this area so far.
Some people wrote in the chat, they have a wellness committee, and that she's gathered results on a wellness survey that she put out recently. And then they also have a wellness committee and an EPA as well.
Okay, so that, yeah, employee assistance program, those seem pretty popular. Did other folks have those in their workplace too, where employees can, have a few sessions or just kind of an ombudsman person to contact? I've seen a few head nods. Having these groups can be a great opportunity for these discussions to get started, but it also requires a lot of vulnerability, not just from employees, but even from like yourselves, leaders and kind of role models, supervisors in these organizations too. So once we have these types of groups, you know, and we start collecting information around culture and wellness, then there is a expectation too, right, that something's going to change, or right, that we're going to put something in place, that we're going to start addressing these. So it's a really great first step too, like you said, and then opens up these larger discussions that we should be having, right, to make our workplaces healthier and to keep those employees that we have too, right, because retention is huge, especially across all of our fields, nursing, you know, pharmacy, behavioral health. We just cannot get enough people right now. So I'm going to go back one too, just to this diagram. Are there things within your organization, like, are there other ways you're involving employees within the workplace, within opportunities? Are there ways that you increase kind of communication across different employee levels that have worked well either?
In the chat that we have organized things like potlucks, door decoration contests, etc., just to get people together for fun things. She believes we used to have a lunchtime mindfulness practice at one time too, before her time. She said, coincidentally enough, our wellness committee hasn't met in a while because of all of our members are terribly stretched thin with workload. And then it's challenging as a large majority of employees that are remote. Virtual meetings only meet once a quarter.
Okay, you're raising several things here. This is so great to hear from you all too. So on one hand, you're integrating these activities that are kind of fostering a sense of community. So having shared space together, doing activities, bringing together folks for lunch. So that's going to increase communication. And some of that could be employee recognition too, right? You're bringing folks together. You can talk about successes. You can talk about some of those shared challenges in the workspace too. And then this other aspect, how many of you all have a portion of your staff or employees working remote still? Okay, so we have a full range here, and I think that's pretty normal across a lot of organizations right now. Some folks remained remote since the pandemic, and we've all had to shift in what that looks like for engaging folks. How do we foster connections, right, with people that we're not seeing? Or like a couple of you mentioned too, if these meetings or kind of collaborative workspaces, committees are only coming together once a quarter, what's happening in the between of those 2-3 months, right, that are going by? Yeah, so what's already working? You might also consider thinking about like psychological safety, emotional safety right within the workplace too. A need maybe to have diversity and inclusive conversations with employees, thinking about how you can, and we know organizations, right, are limited. Like you all said too, folks are stretched thin with their time anyway. So how can we make the most from those types of wellness committees or the activities that we're implementing? And then how also do we know, right, what our employees need too? What are the needs that they're experiencing? What kind of supports or resources would help them come into the workplace, right? And then also this piece around recognition, communication, and involvement with the organization as a whole is something that we've seen, in the past couple of years of working on this training program together from our community practitioners, was really that folks valued and felt, one of the things that was lacking in their organizations was often around decision making or misalignment between kind of what they're being asked to do, organizational values and personal values. And those types of conflicts might be more internal than external in a workplace, but could certainly come out in employee actions, their engagement, participation. We even see that start to affect employee attendance at work too. Thank you all so much for sharing about your own experiences in the organization. It was really great to hear what you're doing, what you've seen so far, and what some of the responses have been from your employees as well.